Good morning, I'm Nick Altmeyer with linkinglewiscounty.com. I'm here today with April Bennett from Cornell Cooperative Extension in Jefferson County and Anna Platts with Lewis County Public Health.
Good morning.
And we're here today to talk a little bit about a series of workshops that are coming up titled Adopting Healthy Habits. This is kind of for adopting a plan in your workplace for instilling some healthy habits. And the Adopting Healthy Habits is actually a coalition that involves a tri-county area of Jefferson, Lewis, and St. Lawrence counties. So Anna's going to tell us a little bit about who belongs to the coalition, what the coalition's about, and then we're going to get a little bit into the 4 sessions here of the programs that you guys are trying to promote.
We are very fortunate to have quite a broad representation of community-based organizations throughout the Tri-County area. From Lewis County, we have Lewis County Public Health, we have NERCL on occasion, a lot of representation from Jefferson County, we've got Cornell, we've got Planned Parenthood, we've got Jefferson County Public Health, please chime in when I forget them. We've got Fort Drum Regional Health Planning Organization.
North Country Prenatal Perinatal Council.
Brooke is often there.
Public Health from all 3 counties is very involved.
Yeah. Sometimes we get representation from Samaritan on occasion. We've got representation from Syracuse at our last meeting. What was her name? I can't remember, sorry.
Visiting guest.
Yes, but if people can't attend the regular coalition meetings, we have a very active boots on the ground crew that helps spread our information and all our initiatives.
Okay. So with the Adopting Healthy Health Habits workshops here, basically if your organization's looking to enhance productivity, reduce healthcare costs, and create a healthier, happier employee, this series will provide assistance at every step from creating buy-in to developing a sustainable wellness policy. So the first session is going to be kicking off on March 7th. All the sessions run from 12 to 2 and will be held at the Cornell Cooperative Extension office in Jefferson County on North Hamilton Street. All the workshops are free, and lunch is also provided too. So
thanks to our sponsor Fidelis, they are underwriting the cost for a free lunch for everybody. So as you said, it's really aimed at any organization or business that wants to be successful, because we know that worksite wellness programs really do help increase that productivity and make for happier, more productive employees that are at work more often.
Okay. And each session is limited to the first 40 participants, and you do have to sign up ahead of time. We'll get you some of the sign-up information toward the end here. Obviously, you can call April here at 315-788-8450, extension 265. And there's also a link on the Cornell Cooperative Extension website where you can register online. So,
or you can go right onto our Facebook page, and we have it listed as an event. You can sign up for one or more of the workshops individually and register right through Facebook.
Okay, so let's get started with the first workshop. That's going to be on March 7th, and that's getting started and improving your facilitation skills. So did you want to talk a little bit about what that particular one involves?
Sure. So this is really aimed at organizations that either have never had a worksite wellness program, or maybe you had one in the past, but it kind of fizzled out and you're looking for some new ideas to kickstart your program. And we're going to talk about, if you're an employee and you want to bring a program like this to your office, how can you be a better facilitator? So how can you get that buy-in that you're going to need to get things started? How can you define wellness for your group? Because we know that wellness can mean a lot of different things to different organizations. So how can you figure out what's going to be the best fit, what's important to your employees, collect that information? We're going to get a really great presentation on data collection and an evaluation from Fort Drum Regional Health Planning Organization. So making sure that these programs are as effective as possible. We also know that data collection is really important for the long-term sustainability. So getting those decision makers at your organization to really buy into the program. So we're going to drill down on all of that. We're going to provide a lot of resources on what kinds of programs and activities might be a good fit for your organization. We're going to hear also from Michelle Graham at the YMCA. She facilitates a lot of groups, what has made her group so successful, and really get to know each other and find out kind of what is out there in our communities and what's been working well. And we see this as a great networking opportunity for organizations as well. And then, of course, we get free lunch, so we'll have healthy lunch. And then Jamie Wood from Page Fitness will be coming over to provide our fitness break. We want each workshop to also model the types of habits that we would encourage organizations to adopt. So when you have a meeting, how can you weave wellness into that by making sure that the food or the snacks that you provide are healthy? If you have a long meeting, how can you give your employees an opportunity to get up and stretch or be active as part of the meeting? So we're trying to weave some best practices into the workshops as well. So that's another thing that people will take away.
The fitness breaks listed for each of these sessions kind of caught my eye, so I thought that was a great idea to kind of incorporate that into what you guys are trying to do, so it's great.
Our coalition does that whenever we meet. April does a fantastic job of facilitating some sort of activity during our meetings because we know we need to practice what we preach, and we look forward to it. It keeps us stimulated and energized for however long our meeting may be on a monthly basis.
And now there's so many great groups out there. We thought rather than just do it internally, it was a nice opportunity to reach out to some new community partners and promote their businesses and show people just all the different ways there are to be healthy in this community. So we're excited that they're part of this event.
Great. The April 4th session is going to be using marketing and social media to promote wellness. As we all know, social media can be a great tool when you're promoting different things, especially from a business perspective. So do you want to talk a little bit about what that session is going to actually involve and how that fits into what you guys are doing?
Sure. Well, it's something that we, as part of the Adopting Healthy Habits Coalition, have been trying to improve our own skills on because we know that this is a great way to reach the community, but it's not a skill that everybody comes to their job possessing. So this is something that we thought, we can learn from each other, best practices, and we'd like to also offer up what we have learned to the greater community. We know that promoting wellness through social media is a great way to attract new people to your site, to find out more about your organization. Even if your organization isn't a wellness-based organization, showing that you are wellness-focused when it comes to your staff is really important to the community. So we wanted to highlight that. So we're bringing in a lot of speakers in this session that are going to talk just in general about some best practices when it comes to marketing and social media. And then we've got public health talking about how they use that to promote the activities that they have, that they use social media like Facebook, how to figure out what social media platforms are going to best reach your target audience. There's going to be a lot of information packed into this session.
It's a great opportunity to learn from what's gone well at other organizations and some mistakes in how you counteracted them. Like April said before, it's also a networking opportunity. So often Lewis County Public Health is tagging Cornell or vice versa in our efforts, so we know that we're all working together to reach a common goal of increasing wellness. So it's a great opportunity.
We also know that most organizations don't have large marketing budgets, so we're usually working with a very little, if no budget at all.
Right.
So how can we maximize what we can do with little to no money? And a lot of that is just, like Anna said, tagging each other, keeping each other aware of things, supporting each other through social media. So we're going to be promoting a lot of that. We're also going to talk about just some basic things like how to write an effective press release. So when we're having an event, how can we best get it out to the community? And doing things like this today are some of the things that we've been learning. We want to share those with the community.
And we actually run into that sometimes where people have a message to get out or an organization wants to, but they don't know how to put it in the correct format or what to do to submit it and things like that. So I think that I've said that for a while, that especially here in Lewis County, that some of these organizations, something like this that can help you, develop a press release, things like that, so you can get your message. Because we have lots of great platforms now, and not just our own, but there's plenty of platforms that you can put your information on, especially with social media. So that's a great skill to have, for sure.
We're all going to learn a lot that day.
Yeah, we're really excited for that one.
The May session is going to be on May 2nd, and that's going to topic there will be how wellness initiative can improve employee satisfaction. So that's always a big one that I'm sure a lot of employers are interested in. So if you want to talk a little bit about what are some of the topics that will be covered that day and how employers can get their employees a little happier.
Sure. We have the Northern Credit Union is coming in. They have been doing some really innovative things with their worksite wellness program. They just put in a fitness center for their employees. So they're going to talk about why they chose to do that and what the benefits they have seen from a program like that. So we're going to talk about everything from very simple strategies that employers could implement to increase productivity to maybe some of these more innovative best practices that are out there. We're also going to give some tips. We have Pivot coming, and they're going to just talk about how we as employees can juggle that work-life balance and bring some more mindfulness to our own work, and just some very simple, getting up every hour and taking a walk, making sure we're drinking enough water, just some of these really simple practices that anybody can implement, but that we may not be really aware of or may not be implementing currently. We're going to bring all of those strategies to this one. So this is a great one for employers also that maybe have thought about worksite wellness but weren't sure if it really fits in with their mission or how they can fit it into the day, to see that it's not that difficult to get started.
And I'm sure part of the goal here probably too is to maybe if some of the employees learn some of these tactics and things at their workplace, these are things they can take home and implement in their everyday life, and with their families and maybe even their friends and things like that. So it can actually kind of reach out beyond just your workplace by implementing a program like this.
Definitely. We think this is a really big community effort. We know that a lot of our organizations work with the community, and we're trying to educate communities about healthy habits, but it starts with us. We have to be practicing these things first, and oftentimes we see that businesses that do work with the community, we forget about ourselves, or we get burnt out easily, and we want to try to address that now so that we can be stronger community partners and community leaders.
Great.
And from a public health perspective, the first two priorities in our community health improvement plan are reducing obesity in adults and children. And just like you said, if we have the opportunity to grasp the attention of these adults and these different community-based organizations, we know they're going to take that home, and hopefully their kids will benefit from it too. It's a kind of a top-down approach, but it's a trickle effect.
Yeah, definitely. Great. So, excuse me, the sessions are going to wrap on June 6th, and that's going to be creating a comprehensive wellness policy. So I'm sure this is kind of taking all the information that you've kind of gathered from the first 3 sessions, if you were able to attend all 3, and kind of working this in together to develop a plan for your organization.
Yes, that's right. So at this point, we're hoping that organizations will have great resources. They've started to implement some best practices, but we want to take it to the next level and make sure that all these best practices stay sustained throughout the life of the organization. And the best way to do that, we know, is through policy. But a lot of organizations are scared about policy. It's formal, it's a commitment, and they oftentimes shy away from that. So we want to really kind of demystify the process, make it feel less daunting, show some examples of strong policy that would be effective to implement, and then show how you get that buy-in that you're going to need. What we don't want to see is great things happen at workplaces and then they die off when an employee leaves, or that programs start to fizzle out. We want to make sure they become the culture of the organization, so that no matter what happens, it's just a part of the way that we do business. And the more that we see that happen, the better we're going to see the community start to grow and tackle some of these issues we've been working on.
And the policy is also an opportunity to look at it again down the line in 3 years. A policy is an opportunity to say, okay, in 2 years or 3 years, we will reevaluate this and see if best practices have changed, if something was successful, if it was unsuccessful, and maybe it's an opportunity to bring new life into the policy as well. So it gives you that something to look forward to, and room for change too.
I think that's a good point, because oftentimes people think of policy as something that's set in stone, that we have to live with this forever, and showing that policies can still grow and change. It's flexible. It's not something that once you put it in writing that it never changes. We're going to keep changing as best practices are developed.
Yeah, definitely. All right. And not to give everything away, obviously we want you to attend the sessions, but we talked a little bit about implementing maybe a fitness break if you're having a long meeting, things like that. Maybe have a snack policy, kind of promoting healthy snacks is one of the things. healthy fundraising. Maybe a lot of organizations have fundraising events, so maybe you can work your wellness plan into when you're doing fundraising events, and maybe instead of selling chocolate, you could, find a different.
We've been working for probably about 6 years now on some of these initiatives that you just listed and developing resources and best practices. So we are going to bring all of that to these workshops. So if you want to get started, it's more than just about healthy snacks or physical activity. We have a lot of other ideas that could be woven into wellness policies, even things like making sure that your workplace is breastfeeding friendly for your staff and for the community. So all these things we'll be bringing in and helping organizations to weave them into either an existing policy or creating a new comprehensive wellness policy.
And if your organization is interested in implementing some kind of wellness policy, and maybe 12 to 2 on a weekday is just not feasible for somebody from your organization to attend, what else can you do? Is there information on your websites that they can access to kind of do this on their own, or are you available to answer individual questions for organizations when they have needs like that?
Yeah, so we have an Adopting Healthy Habits webpage right at ccejefferson.org, and it lists all of these different resources that we've been discussing. We also have a link to our referral form, so if an organization can't make it to one of these workshops, they can also fill out that referral form and give us a little more information about where they're at and what they're looking for, and then we will follow up with the coalition and bring them the best resources that we have. After these workshops are over, it's not just 4 workshops and we're done either. The idea is that we're building a network, so we will follow up with all of the participants and see how we can best support them as they move forward with these initiatives.
Great.
As a coalition member, that's one of the tasks we're often given. We just recently connected Double Play to Cornell, and they are going to work together to hopefully implement either some sort of worksite wellness or some nutrition education at one of their sites. So it's things like that, and that was done through the referral form. I mailed it to them, and they mailed it back, and now things are starting to get rolling. So it's a very easy process, very user-friendly.
Great. So again, we wanted to give April's number here at Cornell Jefferson. It's 315-788-8450, and that's extension 265. And again, if you wanted to sign up for this series of events, or if you had any other questions, it is limited to the first 40 people. So first session is on March 7th, so you want to sign up as soon as possible. And you can also register online. There is a link on the ccejefferson.org webpage.
That's right.
Okay. Did you guys have anything else you wanted to add about the sessions or the healthy?
Yeah, we're about half full right now, so we do still have space for new participants, but we do encourage everyone to register ahead, and that way we can also make sure we feed you, which is important.
Great. And again, this is for anyone in Jefferson, Lewis, St. Lawrence counties, so
that's right.
It does cover the whole Tri-County area regionally. So, okay, ladies, well, really thank you for coming in today to explain that a little bit, and we wish you the best of luck in adopting your policy.